You want to start today?
Sure. Welcome everyone to Vitality's Facebook Live. I'm Sean and Kevin. Today we're talking about itis, inflammation of joints. We actually did a video a few weeks back about inflammation, generalized inflammation of the body. So for a more in-depth view at what happens to the body due to inflammation and ways of helping your body rid itself of inflammation, check out that video on our Facebook page. But today we're going to talk about the kind of the annoying itises, right? The tendinitis, bursitis, a big one, sacroiliitis. So all these things, these annoying,
usually due to chronic kind of inflammatory problems, right?
Yeah.
That just wear and tear that keeps repeating on a specific joint or structure, tendon attaching to a bone. And, they're very annoying because normally they're debilitating to the sense that, most people have to stop their sport they're doing or whatever it is that they do exercise-wise. So we'll discuss today a little bit how those happen.
What you can do to
help or prevent getting these disorders for sure. Some of which, again, like we always like we mentioned in previous ones about generalized inflammation in the body. So if we kind of recap a little bit of let's
go over that.
Why would the body have inflammation? Well, there could be kind of three main sources of why the body can have inflammation. We're always looking at something physical.
Yeah, so repetitive trauma creates inflammation.
Chronic motion, chronic posture.
Yeah, repetitive stress and strain.
Yeah, so those would be more physical reasons of why inflammation would build up in a specific area. Then we have chemical. So definitely chemical in the sense of what we're eating, drinking, all these types of things that can have an impact on our system and have normally an immune response, which would kind of create this inflammatory response in the body.
Yeah, which is normal, right? But when it's chronic, it becomes a problem.
Yeah.
So if you need an inflammatory response to help the healing process, but if it's chronic, then it can lead to a whole whack of things.
Yeah.
And hey, Kelly, how are you?
And then one of the last ones would be emotional, and emotional, which we discussed in terms of the adrenal glands. So stress factors, things like that can bring the body into a state where inflammation would be more prevalent.
More present.
Yeah.
So let's give an example.
Sure.
Let's talk about golfer's elbow or medial epicondylitis. Right, there's the itis.
Yeah.
So from a structural standpoint, it might be a repetitive stress and strain. So that the medial epicondyle is right in here. What it is you have a lot of attachments from the muscles of the forearm. You have attachments of the muscles from the arm down to the forearm. Sorry, I'm out of the camera. And that just based on the motion in golf, right? They've nicknamed it golfer's elbow, but it's actually medial epicondylitis. Now, that could be a factor in itself, right? You could have that repetitive stress and strain that creates little micro avulsions or little tears in the insertion or the ligaments or the tendons that insert into that epicondyle, right? So that's an example.
It would be like the tendon attaching to a bone where the bone has kind of this skin on it, and then what happens is it's constantly tugging on the same attachment point, creating this inflammation at that site, which is very, very sore.
Yeah.
And like Sean said, it could be due to repetition. It can also be due to faulty mechanics.
Faulty mechanics. So position of the elbow, position of the wrist, position of the shoulder, right?
Yeah.
So if your biomechanics aren't optimized in that repetitive stress and strain or those repetitive motions, it will overload your body's capacity to deal with that stress. And then a red flag is the itis, is the inflammation right there. So now, like you say, mechanics of movement are one cause.
Yeah.
The other cause could be shoulder problem. The other cause could be wrist problem, right? This is a hinge joint. So if there's tension along this line from the wrist, if there's tension along this line from the shoulder, that can create an imbalance, which can overload that junction where it attaches. That's a classic example.
Or even compression in the neck that could basically have impacts on the neurological system going to those muscles as well. So there's a lot of like mechanical related issues that can contribute to that.
Yeah.
Overuse. type of injury.
Overuse, imbalance in patterning, right? So a bicep that is hyper compared to a tricep that's hypo.
Yeah.
Now, this can get into a whole whack of reasons why this could be a potential cause. But if we think about muscle organ relationship with respect to the triceps, we could go more into the biochemical aspect, which would lead us towards insulin sensitivity. So it's fascinating what could create this imbalance. But then the stress and strain of the golf would allow for that red flag to kind of rear its ugly head.
So then the chemical part. So let's say like Sean was saying. So that scenario could be, what we're eating on a regular basis, having an impact on the gut, or let's say, for instance, on the sugar metabolism in the body, affecting the pancreas, which leads to the weakness of that associated muscle, and then you get the pain in your elbow. Well, the source of the problem isn't your elbow; it's actually something chemical. So then there are ways to evaluate that to make sure that we're on the right track with how to treat something like that. And that's why sometimes too you have these types of problems that tend to linger and go on and on and on. And normally, you'll see that they're getting treated, and
exactly, and it's still there, right? You get treated, and you're like, why is this pain still here every time I go golf? Well, you got to take a step back, and you got to ask yourself different questions. Okay, well, where else could this be coming from? So. Let's talk about therapy. Let's say you do have a tennis or a golfer's elbow.
Yeah.
What are some of the things we could do to help alleviate the symptomatology, right? And you can do things like soft tissue mobilization, right? You can use things like a lacrosse ball to work the line above and work the line below where those muscles attach. Those are things that you can do at home by yourself. You can, like we talked, address the inflammatory component. So I'll let you get into that with respect to prostaglandins and stuff. So.
Sure, yeah. So then it would be to know why, like if systemically you do have inflammation, well, it's that's which we do on a regular basis. We'll try and figure out, well, why does this person have more inflammation than normal? Which, in a general sense, is usually why you'll see like an imbalance in either prostaglandins in the body there are 3 different types, like we mentioned in the adrenal video. One of which is really pro-inflammatory. It's causing inflammation in the body. So these are all the essential fatty acids that actually rebalance these prostaglandins. So it could be as simple as someone lacking omegas, which happens quite often. And the thing is figuring out, well, what's the real reason they're having it? Some people, it's because their diet has too many things in it that they're intolerant to, that they have this reaction in the body, that they're slowly developing this inflammatory condition in the gut, which then goes through the bloodstream, and then you become a cesspool of inflammation. So a lot of these people wake up, so you probably hear this all the time, waking up and they're super achy.
Joints.
They take time to get going in the morning, and they're sore, and then once they start moving, they feel better. That's usually a good indication that there is some inflammation happening in the body. General body weakness, tired all the time, achy joints, stiff, like really stiffness, and injuries that are not healing properly, or conditions, not just physical injuries.
Sinusitis, right? This is another inflammatory condition, right? Exactly. That people get these chronic sinusitis conditions. We hear about that all the time, but it's along the same lines of an inflammatory complex or an inflammatory dysfunction that happens when the body's out of balance, right?
Yeah.
I guess worth mentioning too, with respect to the inflammatory and what you can do to help reduce inflammation in the body, is this whole acid alkaline balance, which is very important. So when we talk about achiness, trying to avoid foods that create inflammation, foods that offset that acid-base balance.
Yep. Some people are just dehydrated.
Some people are,
right?
That's an awesome, dehydration, right? So I use this example all the time. Imagine your cells are like grapes or raisins, right? They're the same thing, a grape and a raisin. One's dehydrated. So imagine the capacity of your cells, right? We're made up of 70, 80, 90% water based on different cells in our body. So imagine these cells, if they're like raisins, they're just kind of grinding and they're matted down, they're stuck. So your tissues, they don't have the capacity to glide and slide around each other, right? Your muscles are all enveloped in this fascia, and if imagine them just being all kind of matted down and stuck, that could create imbalance. That could create that tissue tension that just throws you over the bridge, and then you got a bursitis, you got a tendinitis.
Right? Water. I think our next talk's gonna be water. Actually, it'd be worthwhile to spend a little bit of time.
This is actually water in here. It's not
it's not scotch. The importance of water will we're gonna write that down. I think it'd be really important to have a little bit of a talk on water.
Yeah, maybe let's next week let's do water. Yeah.
Tons of people ask about it, and there's some pretty cool stuff you could do just to improve that situation without costing you a fortune either. Yeah. So back to recap, when we look at things that to help with prevention for this type of injury. Number one is you got to have some sort of routine of mobility. So like the more mobile you are, or the more you take care of your body, the less chance you will have of getting these types of injuries. One is, and then two is making sure in the general sense, inflammation, we're eating well, we're not potentially abusing the body to the extent where inflammation is going to build up. So things like alcohol, these are all things that will increase. So if ever you have an injury like this, you got to really consider not just getting therapy, let's say, to speed up the process. You can help the process on your own.
Oh, just by reducing
decrease sugar.
It's crazy.
Decrease alcohol.
Yeah.
Obviously right now,
Omega-3s.
Before the holidays might be a little bit hard, but in January it could be a little easier. And then, like Sean said when he grabbed his balls before, you can use these tools to basically unwind certain adherences and tensions in musculature. We use the foam roller a lot to do stuff like that. All these things are great to try and decrease the likelihood of something like this happening.
Yeah, one of the things that we teach in here is it's your body, right? It's and you only get one, so you have to take control. You have to you got to do the little bit of daily maintenance that it takes to show up every day the best version of you. So soft tissue mobilization, right? So whether it's using lacrosse ball, the foam roller, is such an easy way to allow or to decrease tension, increase blood flow, to normalize movements and to optimize your joint mechanics. So that's a huge thing that you guys have control. The other one is posture, right? Your alignment, the way you move, right? We can look at people. I always use this example. Watch Roger Federer versus Rafael Nadal. Okay, Federer is in his late 30s. He's still almost at the top of his game. He moves like a ballerina on the court. He's effortless, right? Mm-hmm. And then you watch Nadal. Nadal's had, guess what? He's had so many tendinitis. He's had knee problems, knee surgery. He's had injury after injury because he moves like a bull in a china shop. He's like so aggressive and he pounds the pavement. But so optimizing the way your movement patterns, the way you hold yourself, will reduce the chance of developing these tendinitises. These right. So whatever
posture. Good point. Like at a desk,
sitting at a desk. It's funny how carpal tunnel is kind of another example of this process over time. Yeah. This inflammatory process over time from people just sitting and imagine doing them like this with the mouse all. Right? For 30 years, and you're like, oh, I didn't know that's creating this problem, but it does, right? Yeah. So posture. What else?
I think, that's pretty much it. Like if we look at the preventative part, getting some therapy, working on the whole nutritional aspect of things to kind of help that out. And then the last one, and probably the most important too, is mindset. Mindset in the sense of how much stress you have on a regular basis, because that will directly impact the adrenal activity in the body, which
will make you more susceptible to injury.
Exactly. Right? So like you're in less of a recovery phase when your adrenals are kicked in all the time, pumping cortisol in the body to get you to do stuff. But it's very difficult to recover when you're in that stage constantly. So this is a very, very important thing, and most people neglect this aspect of things, and we're really adamant about explaining it to people properly on what they can do to. You're never going to eliminate stress.
Stress is actually you
let
need
me
stress.
Rephrase that. You could eliminate unuseful stress in your life for sure, but there's certain things that are just there, and we can't get rid of our kids. You can't get rid of whatever other kind of issues that are important. But you got to learn how to deal with them differently.
Yeah,
so
it's
that
your
the
body's
impact-
reaction to stress, right? So there are tools, right? So we teach
Absolutely.
this. There's breathing. There's
changing perspective too. Sometimes, like just the fact of thinking of something different too, which will be another talk.
Yeah,
we'll do that one of these days. Just the whole thing on mindset it's incredible what you can do just by shifting the way you look at it.
Mm-hmm.
So
because you choose how you react. Yeah, you choose how you react to something, right? So you have that choice. What else? So we talked about breathing to reduce inflammation. Sure. Actually, breathing actually helps oxygenate and alkalize the body. So coming back to that acid-base balance, it has a huge impact on the adrenals. It has a huge impact on building up that parasympathetic, which is like the rest recovery, portion of your nervous system.
Yeah.
So
breathing, that would be another good one just to do on breathing.
Yeah.
So we got a couple topics coming up.
But next week let's do water. Right?
Yeah.
So
we'll do water next week.
And if you guys know anyone who is suffering from, we all do, right? Tendinitis, biceps tendinitis, bursitis, right? Anyone who's suffering from these things, or even share this video with them.
I think the biggest one is just that what we mentioned before about the waking up and feeling achy and tired and sore all the time. That's not normal. So when people say, but I've always been like that, well, time to get it fixed, because there are some easy things you can do to do that. So very, very essential things to kind of optimize the body here.
Yeah.
So hopefully you guys liked it. We'll be back next week again.
Yeah, check out our Facebook page if you want more information on inflammation in itself and what happens as a result of inflammation. We did a video a few weeks back. You can check that out on our Facebook page. As always, we love doing these videos.
Yeah.
Questions or comments below. Any video ideas, any health topics you guys want to hear about, we'd love to.
We want you guys to challenge us.
Yeah, we'd love to. to if we know about it, we'll help them out, and then we'll research if we don't. So
even if we don't. Yeah.
Anyways, have a great day, guys.
Yeah.
Have a nice weekend. We'll see you next week.
Ciao.